Good afternoon and welcome to the August 2021 DIBBLE Institute webinar, Targeting Teens in Arkansas, Building Better Relationships. I'm thrilled to have you all here today and as well to welcome our two presenters who I will be introducing, Sarah and Charles, a little later on. So Esther, the next slide. Oh, and by the way, Esther is engineering, so thank you, Esther, for that. So next slide. So just to, before we go any further, would you go over to your control panel and there is a place where you can raise your hand. So if you have never, ever been to a DIBBLE webinar before, would you please raise your hand? I would just like to, it helps me to know how many people are new. So how many people are new to DIBBLE? Okay, that's great. There's a few of you who are new, so we'll start at the very beginning, as Maria von Trapp would say. Charlie and Helen DIBBLE started the DIBBLE Institute. People often wonder about our names. Our name, Charlie loved working with young people. He was an engineer in his first professional life. He has many patents for electric jet engines, but in his retired life, in his second career, he started working a lot with young people. And he saw the suffering that his young friends experienced when their parents' marriages or relationships derailed, how it could impact their lives. He also saw how many of them were not confident that they could get and stay in a committed, perhaps married relationship. And they were very, they'd go to their wedding and say, oh, it's just my first wedding. So Charlie was a fix-it guy and said, I can do this. I can work on this. And this was in the late 80s when there was just new research coming out about what made for safe and stable and healthy families, how to create healthy relationships. And he talked to those researchers, and they could go on and on and on about what they were learning. But when he asked them, what are you doing for young people? They would say, we don't know. It's not our wheelhouse. So Charlie gave us this founding idea and vision that, one, all young people should be able to learn the skills around navigating their intimate relationships, that should just be a normal part of a young person's development, that we can do that with research, and that we can make a real impact. So that's what Charlie had us do. The DIBBLE Institute translates research into teaching tools that we make available to people just like you doing direct services. We don't do direct services that help young people get smart about their love lives. So the next slide. So last year we had orders. This is just where we got our orders from. I think that's 43 states in the nation. We think conservatively we, meaning us, DIBBLE, as the curriculum provider, and all of you who do the hard work, reached over 67,000 young people. And that doesn't count the young people who were reached from people who purchased the materials the year before or the year before that. So Charlie was right. We can be quite leveraged and really make a difference with young people. And so, as it says, we're a national independent nonprofit organization. There's no one behind the screen. It's just us. And our founding idea is really to be research-based. So next slide. Our mission, I kind of alluded to it. We want to empower young people. Young people need thousands of levers pulled. We all did. We all do. Hundreds of levers pulled to be able to be ready for a productive adult life. And one of them is this information around gaining agency in your intimate relationships. And hardly anybody talks about it. I know my advice from my family is things like, you'll figure it out. You'll know. And we know now that there's so much more than that. We can give people skills and knowledge to be really smart about their love lives. And it doesn't, again, not based in ideology, not based in theology, just good, solid research. And that's our mission, is to get that out there. Next slide, Esther. And so, as I said before, we're big fans of research. We not only, everything that's in our materials is research-based, but we also evaluate our materials. And we can see that what's interesting is when you help young people in this area of their intimate relationships and building the skills around that, you impact sexual behaviors, you impact violent behaviors, you impact mental health, graduation rates. I mean, there's so much there's so many levers that the relationship world can pull, and it's all based on this fundamental research. Next slide. So we're also big fans. We talk about families a lot and what is a successful family, and we believe in safe, stable, and nurturing families, however they come. Often it can be easiest to create that safe, stable, and nurturing family if you're in a committed, long-term relationship like marriage, but it's not impossible to create a safe, stable, and nurturing family with other family forms. And that's the most important part for kids, because kids need that lack of turbulence. They need that placidity to really thrive. So we're just big fans of that. And our final slide is that we truly believe that relationship education is for everyone. It doesn't matter who you are, how you were identified at birth, who you love, how old you are, what kind of relationship you're in now, what kind of a relationship you want to be. Every relationship can get better with relationship education. So I'm hoping, this is my Lamaze story. Lamaze, it's about breathing, right? And we never say to a pregnant woman, my gosh, don't you know how to breathe? Why do you need a Lamaze class? Well, they do, because it's special breathing, right? So this is the same. It's like, of course we can all have relationships, but so much better if you know the skills. So we really admire you all who are working in this field and appreciate the good work you're doing, because every one of us every day in this field is helping young people pull a few more of those levers for young people that are so important for their eventual success. So thank you. All righty, next slide. So here are our friends at Arkansas Children's. And if you are not from Arkansas, I will need to put in the word hospital there. So this is Arkansas Children's Hospital. Sarah, Harlan, and Charles Maxwell are joining me today. They use our program Love Notes in their programming. Sometimes our webinars are about research, sometimes they're about practice. And this is a practice one, because it's very interesting how a hospital, you think, how does a hospital come to do pregnancy prevention in their surrounding communities? So a little bit about Sarah and Charles. Sarah is the outreach specialist for Arkansas Children's. But here's the little tidbit, she likes to camp. And she even sleeps on the ground, which I admire. So, because I still can't, but I haven't slept on the ground in years. So anyway, good for you, Sarah. Thank you for joining us today. And Charles is the outreach specialist for Arkansas Children's. Here's his tidbits. He used to be a firefighter, and he teaches cooking classes like they're a game show. So super fun. If you're a teenager in Arkansas, sign up with Charles. So thank you both for joining us today. I'll hang off now and leave it up to you. Thank you.
Well, thank you, Kay, for that wonderful introduction. Like she said, my name is Sarah Harlan. I am an outreach specialist at Arkansas Children's, and I'm joined today by my coworker, Charles Maxwell. We're going to tell you today a story about how we've taken Love Notes and really applied that curriculum to our work. If you could go to the next slide for me, Esther. After this session, you will understand how Love Notes aligns with the mission of Arkansas Children's. You're going to understand how we've really implemented Love Notes, and you're going to gain some insight into how we've increased community partnerships and how we've reached the rural areas of Arkansas with health education. So with that, I'm going to turn it over to Charles and let him walk us through the first few slides here.
Good afternoon, everyone. I'm going to start by giving you a little background. So Sarah and I are both housed at Arkansas Children's in Little Rock, but we work for and are part of a much larger system. So Arkansas Children's is the only hospital system in the state solely dedicated to caring for children, which allows our organization to uniquely shape child health in Arkansas. Now, we are driven by 4 core values: safety, teamwork, compassion, and excellence. These values inform every decision and every action in our system, from the aggressive pursuit of 0 hospital infections to treating each family with dignity, kindness, and concern. They fundamentally guide our work here at Arkansas Children's. But while Arkansas Children's is also dedicated to more than a century of providing care to critically ill and injured children, today we are more than just a hospital treating sick kids. Our system now includes 2 hospitals, a pediatric research institute, Foundation, which is our fundraising arm, clinics, research, and of course, outreach. We believe our work will not be complete until Arkansas is the healthiest, safest place to be a child. Now, at Arkansas Children's, we are champions for children, and we promise to the children of Arkansas is to make them better today and create a healthier tomorrow. So in order to accomplish this, we must change the way we deliver care and how we reach the more than 710,000 children in Arkansas. We want to reach them where they live, where they learn, where they play, so in their communities. We really want to have care closer to their homes, and we must collaborate and work with champions for children around the state in order to fundamentally improve the health of our children. Now, that healthier tomorrow piece is how our community engagement department contributes most to this mission. So our department was established in 1997, so we've been around for almost 25 years. In that time, we have worked with many, many schools and organizations across the state with the intent to make Arkansas a healthier place for kids. We currently offer a variety of programs to our partners. For me, for example, like I was introduced, I actually do food insecurity and nutrition. I utilize that Cooking Matters program, and this program teaches participants how to shop for healthy groceries on a budget. Now, I also work closely with Helping Hand, which is a local food pantry located near our Little Rock campus here at Arkansas Children's. We distribute free grocery bags to our clinics. This allows nurses in these clinics to give patient families who are identified as food insecure a bag of groceries to take home for their families. We have team members in our department who lead Project Prevent. This is a statewide program for Youth Tobacco Prevention Coalition here in Arkansas. They have members in local chapters across the state that choose to live their lives free from tobacco and nicotine and encourage others to do the same. They really have a huge focus on vaping and e-cigarettes these days and are working with schools to focus on cessation rather than punishment for students who are caught on campus with nicotine products. Now, Sarah also offers a babysitting 101 class in the summertime. This prepares participants to be safe, nurturing, and fun babysitters. We have a community garden on campus here. All the food grown in this garden is actually given to Helping Hand, that local food pantry I talked about earlier. And we also, of course, have Love Notes, which is one of our newest programs. This is why we're here today. So let's get to it. So here's how we selected Love Notes as one of our programs. Start off with, okay, if our promise is to create a healthier tomorrow for children of Arkansas, we have to identify the children of Arkansas's need. The biggest way to determine those needs are through our community health needs assessments. Some of you may know this, but the IRS requires nonprofit hospitals to seek community feedback as they develop plans. These are known as implementation strategies. These improve the health of their communities. Now, these needs assessments and implementation strategies are a foundation for the Arkansas Children's strategic initiative that improve child health. So Arkansas Children's is tasked with completing a needs assessment every 3 years. They will include focus groups, key informant interviews, phone surveys, and secondary data. The graph on the slide shows a breakdown of the prioritized need identifying the last community health needs assessment, which was 2019. So as you can see, reproductive health has long been a priority health need for Arkansas, and in 2019 assessment, 61% of parents surveyed said that teen pregnancy was a serious or moderate problem. Parents are very supportive of the idea of reproductive health education in the school setting. Armed with this data, finding a way to implement an evidence-based program to address reproductive health became a focus for Arkansas Children's. The system began exploring partnerships with our other organizations doing this type of work and exploring evidence-based programs options. In late 2018, the decision was made to utilize Love Notes. Why we love Notes? Well, here you go. What we liked most about the curriculum was that it was comprehensive. For those of you who are familiar with Love Notes, you know what I'm talking about. For those who are not as familiar with it, it has 13 to 14 lessons that cover reproductive health, but it offers so much more. Some examples are getting to know yourself, understanding relationships, how to break up, dating violence, communication skills, don't slide, decide, the success sequence. The list just goes on and on. So Sarah and I were trained to implement Love Notes in January of 2019. Then we began the task of finding partners. Now, we knew we wanted to target the areas of highest need with our programs, so we went back to that data. The very first obvious indicator for us, of course, was that teen births. These are babies born to mothers between the age of 15 and 19. So in 2018, the teen birth rate was 30 per 1,000 in Arkansas, making us the 51st in the nation, counting 50 states plus Washington, D.C. Now, while the rate has fallen 50% since 2000, with the vast majority of that decline occurring in 2009, the state's rate is still far higher than that of the national rate. So if you look at the graph here, you can see the highest rates are in the area that we refer to as the Delta. This is on the eastern side of the state along the Mississippi River. But across the state, teen birth rates range from less than 16 per thousand in Calhoun and Faulkner counties, those are the lighter two counties, to more than 75 per 1,000 in Phillips, Monroe, and Jackson counties, those are those darker counties. Now, we also looked at infant mortality. We know that infant mortality is a good indicator of overall health of a society, so we also want to explore that measure. In 2018, the 5-year average rate for infant mortality was 7.6 per 1,000 live births. This makes Arkansas 48th in the nation infant mortality. This was particularly high among Black and African American infants at 11, when compared to Hispanics at 5.2, 6.6 for whites, 7.3 for Asian or Pacific Islanders. So this racial disparity let us know we still have a long way to go to correct systemic racism in the state. If we look at the 75 counties within the state, we see that infant mortality rates were lowest in Lee County, between Phillips and St. Francis, the lightest county in the Delta, at 2.1. The highest was in Stone County at 19.4, which is in the north central part of the state. We also looked at rates of reported cases of STDs. I won't go too much depth on this data, but just know that generally speaking, areas with high rates of teen births also had high rates of reported STDs than the rest of the state. So we took all this data and we began reaching out to school districts in the high needs areas. We also looked at areas surrounding our 2 children's hospital locations, as you can see here, plus those areas where we had previous contacts. Now, we knew we wanted to keep our numbers small at first and implement the curriculum, sort of like a pilot program. So during the 2019-2020 school year, we found 2 partners, Beebe High School in White County and Midland High School in Independence County. Now, Beebe was a 9th through 12th grade health grade classes. Midland was 9th grade fact classes or family consumer science classes. So with Beebe, we plan to implement 2 rounds of the curriculum, one in the fall, one in the spring, to kind of test it out. And we only had planned 1 for Midland, as they only have facts classes a year-long class. Now, we completed both lessons, or both sessions at Beebe, reaching around 200 students, but COVID restrictions went into place just as we were starting at Midland. Travel was restricted, some of us began working from home, you kind of know the drill. Despite COVID, though, we knew we still wanted to reach these students, so we began creating a virtual format of the program. We implemented the virtual format during the 2020-2021 school year with Beebe and Midland, but we also added 2 new partners, DeQueen High School in Sevier County and Maumelle High School in Pulaski County. Now, these were both facts teachers as well. And they heard about Love Notes program from our teacher at Midland. Now, I have to give credit where credit is due with Ms. Kennard at Midland. Let me say she's just a rock star for us. She not only helped us find these 2 partners, she was able to help us spread word again this spring. And thanks to her help, we've confirmed 16 new partners for the 2021-2022 school year. All right. So in the beginning, I will say one of the biggest problems we had with implementation was, the willingness of the partner. We really wanted to find willing partners to help out with this. Some of the issues, of course, were hesitancy about the curriculum content. With coming from a conservative environment, we did anticipate this. When we pitched the program to a school, we mentioned, well, it does talk about sex, STDs, sexting, porn addiction. We would typically get 1 of 2 reactions. 1, I don't know about this, kind of a little hesitant about it. 2, yes, that's what we need. Please help us talk about this. Now we are starting to see more and more of that second reaction that really help us talk about this, which is really exciting to us. So yes, hesitancy was an issue, but the bigger issue was who we were recruiting. Okay, we were targeting health classes and the health teachers. This seemed like an obvious fit to us. These are the ones who we typically worked with in schools, but they really struggled to find the time to fit those 13, 14 lessons in their already packed schedules. When we started Love Notes with Ms. Kennard Midland, we realized facts classes may actually be a better fit. We knew that facts classes, we may not reach as many students as we could with the health classes, but we found that they had more flexibility to implement these classes. Also around this time, the 2018-2019 year, the Arkansas Department of Education revised some of the frameworks and standards for these facts classes. The new frameworks aligned very well with Love Notes curriculum and created a new dynamics of human relationship class in facts department. So when Ms. Kennard passed along our program information again this spring, we had an overwhelming amount of facts teachers reach out to us. Then just a few weeks ago in July, we attended the annual Facts State Conference as a roundtable of speakers and gained even more interest. Between our budget and our capacity, we were only able to partner with about half the interested teachers for now. But this has been a huge breakthrough for us. Of our 20 partners for the coming school year, 19 are facts teachers, and 13 of them will be implementing it in their new Dynamics of Human Relationship class. Now here's Sarah to speak more about the challenges with capacity and funding.
Thank you, Charles. Yeah, so I'm going to talk a little bit first about our capacity challenges. So currently, our department has 2 health educators who contribute to Love Notes, Charles and I. And I lead the program, so most of my time at work is dedicated to Love Notes, and then Charles is available to jump in and help me as needed. But like he mentioned earlier, our department has many other programs and responsibilities. He has his Cooking Matters program that I help him with occasionally. We have that community garden. We have our food and security work. I have babysitting 101 classes. Charles and I are both child passenger safety technicians, so we have to stay up to date on that. So neither of us are able to dedicate all of our time to Love Notes. Plus, there are only 2 of us, so that really does limit our capacity, and it can be a challenge for us. But I also want to talk a little bit about funding. I would say that most people who are implementing Love Notes are doing so with grant funding of some sort. And we're really unique in that our program is paid for by Arkansas Children's without any grant funding. I'm going to pause for just a second and say, excuse us for our audible mess. We have some construction going on downstairs, so please excuse the background noise. But like I said, we do not have any grant funding for our program. That can be really great for us, but it can also limit us because our budget is, set by the hospital, and it's somewhat fixed, and it can also be reduced. And so it's just something that we occasionally have to work around. But I know a lot of people probably wonder, well, if you're not receiving grant funding, how do you justify spending money on a program like Love Notes? Well, we're a nonprofit hospital. And as a nonprofit hospital, we're held to a higher standard of obligation to our state. We have an obligation not only to our patients and our families, but to the broader community to make a positive difference in their health. And our responsibility is to every child in Arkansas, all 710,000 of them, not just the ones who step foot in our facilities and receive direct care from us. So this work, when we're looking outward and we're trying to bring a positive change to communities, this work is called community benefit. So community benefit is defined as a program or a service that improves the access to healthcare. It enhances the health of a community. It enhances medical health or knowledge. It relieves or reduces the burden of government or other community health efforts. And it's also the basis of how nonprofit hospitals maintain their tax exemption status. So the IRS has specific requirements that we follow regarding how we assess our communities and also how we report this community benefit work. Remember earlier, Charles talked to you about our community health needs assessments. Well, those tie back in here because we base all of our community benefit work, or sometimes it's called community benefit investments. We base all of that on the needs that are identified there in that needs assessment. And to give you an idea of maybe a dollar amount that we put on this community benefit investment, from July of 2019 through June of 2020, Arkansas Children's invested $83.7 million into community benefit work. So it's a lot. And most of that is done through uncompensated care. So if we have a child who comes to us and they cannot afford or cannot pay for the care that they need, we don't turn them away. So $50.5 million of our community benefit work was in uncompensated care. But we also do this community benefit, investments through providing education to health professionals and conducting groundbreaking research in our research institute and offering community health improvement opportunities like Love Notes. So you can see it kind of all ties back in and kind of works with the mission. You go to the next slide for me, Esther. Yeah. To wrap up our challenges, I want to briefly talk about COVID-19. So obviously we had challenges. You probably had challenges. We wondered the typical things like, how are we going to take this program virtual? How are we going to modify these hands-on activities? How are we going to keep students engaged? And the DIBBLE team did a really great job of creating a toolkit that helped with a lot of those issues. So we took that advice, we modified our lessons, But then we also created some self-paced, asynchronous online lessons using a tool called Turning Point, which I'll talk a little bit more about shortly. And these online lessons helped us reach students, but our biggest challenge was that so many of our students live in areas that have little to no internet access. Now, the state used some of their COVID-19 federal funding to buy hotspots to give to schools, who could then distribute them out to the students who need them. But you know, hotspots require cell phone signal, and that's also hard to come by in parts of Arkansas, as hard as that is to believe. So then schools and other organizations thought, well, let's set up Wi-Fi access zones, and people can come here and they can use our Wi-Fi for free. Well, then transportation to those zones was an issue. So even now, we don't have this challenge 100% solved. But what I will say is that this push to go virtual was a really great thing for us. It gave us a flexible option for implementation that really helped expand our capacity and our reach. And I just don't know that we would have ever developed it without COVID. Another thing that really helped our capacity was changing how we were implementing. So when we began Love Notes back with Midland and BB, we were using our traditional model of Charles or I, an Arkansas children's health educator, goes to the school, teaches all the lessons in the curriculum in person, hands-on, in the classroom themselves. But with just the two of us trying to reach schools across 75 counties in Arkansas, I mean, our hands were tied. There just aren't enough hours in the day. We just don't have the manpower to have the reach that we need. So we began thinking, you know, about some other options. And since we knew we couldn't physically teach the lessons ourselves and have the reach we needed, we wondered, well, what would it look like if we partner with teachers and we empower them to implement Love Notes themselves, a teacher-led approach, more or less. And so that's really where we are now. And we want our partner teachers to have everything that they need to implement the curriculum to fidelity. We want them to have materials and support. So from us, they receive an instructor's manual, they receive personality profiles and participant workbooks for each of their students, and we purchase those, so we take on that financial burden. Then we also give them access to those online lessons that I mentioned, and we give them training and technical support. Now, our partner teachers have three options for implementation. They have the in-person option, where they're going to teach it in the classroom. They're going to use the Love Notes curriculum, the instructor's manual, the PowerPoints. They're going to teach it. They have an online option where they can receive a link to one of our asynchronous lessons, and they can then open the lesson and do them together as a class, or they can assign the lesson links in their learning management system. So maybe that's Google Classroom or what have you, and the students can complete the lessons independently. If they go that route, we ask that they provide time for group discussion and debriefing, either virtually or in class, so that those students still have, you know, an opportunity for feedback, to ask questions and to receive immediate feedback. And then of course they have the option to do a hybrid, to use both of these methods. Most of our teachers for the coming school year really do plan to use the hybrid model. They want to teach in person, they want to use the instructor's manual and the PowerPoints, but realistically we know that COVID's still happening and we're going to have students quarantined and we may have to pivot fully virtual again. So we anticipate that they are going to use those online lessons at least partially. Now, with any of our implementation methods, either Charles and I or I will do an introduction to Love Notes for our partner teachers. If they're really going to focus on that in-person option, we may just teach lesson one for them. But if they're going to use our online lessons or a hybrid option, we're going to come briefly introduce Love Notes, and then we're going to do a more in-depth look at how to use Turning Point. So we'll kind of give the students a guide of how that works. Regardless of implementation method, our teachers get to set their own pace. So they're going to build the Love Notes lessons into their regular curriculum over the course of their class. That might be that they do one lesson per week. They may do a few lessons per week. They may block off time and do all the lessons back to back, and we work with them to choose which of those options works best for their classroom. We also require that all of our students complete a pre and a post test. For during Turning Point or using Turning Point for our program evaluation. And then we're available to offer support, however necessary. Now, I want to spend just a few more minutes talking to you about our online lessons because this might be one of our unique features. I'm not aware of many people who are doing Love Notes in an asynchronous format. Like I said, the lessons are self-paced, they're user-friendly, the teachers receive a link to each lesson, but the online lessons offer a variety of activities the same way that the in-person lessons do. So we still have media opportunities. We have videos, we have music videos. We offer multiple question formats. So some of the questions are open-ended or short answer, so that they're designed so that students will really have to think through their responses. We also have multiple choice questions for some of the more black and white, we're looking for a right answer here kind of situations. The lessons will direct them to complete a workbook assignment when that's appropriate, and we also still do the trusted adult connections. If you're familiar with Love Notes, you know about those things. If you could, Esther, let's pull up that online lesson there, and I want to let you guys look at what an online lesson looks like for us. Overall, we found that this online option works very well. Yeah, we're missing some in-person discussion, but what we found is that students who aren't or may not want to express their opinion in class, maybe they're too shy or what they want to share is too personal to share aloud, those students will really express themselves in this online format. So that works really nicely for us. So as you saw there, Esther had her name there. So when a student clicks the link, they'll enter their first and their last name and submit to enter in the lesson. Once they're inside the lesson, they get a welcome page. So welcome to Love Notes. This is lesson 6. Some of the pages are like this, where it's just text and they have to read. Some of them, like I said, have the questions in them or the other activities. They're able to navigate through the lessons at the bottom with the previous and next buttons. If you could, Esther, let's go ahead and go to the next slide. If you're familiar with Love Notes, in lesson 6, you know that students do a Play-Doh activity in the beginning of that lesson. So this is our replacement for that in the virtual world. So lesson 6 talks about, is a relationship healthy or not? And there are 3 questions that you can ask to determine that. Is the relationship conditional or unconditional? Is it disrespectful or respectful? Is it mostly about sex and material things, or is there attraction on many levels? So explain that, and then they move to the next slide. And then we're asking them to give us an example of a healthy or an unhealthy relationship. And we want them to give us a link to a music video or a TikTok. They can make one, they can find one. They can name a celebrity couple. They can give us a personal experience. It doesn't really matter. We really leave the flexibility up to them. And then they're able to answer in the box down at the bottom where Esther's typing for us. Once they're done typing in their example, they click this little envelope or little arrow, and it tells them your response has been submitted. They're able to go back in and change that at any time until they officially submit their lesson. So that's handy if they change their mind or they find something else that they want to say, but they have to resubmit it. And then if you'll go to the next slide, Esther, this is what a multiple choice question would look like in this format. So it would allow them again to select a response. They can change their answer if they think they got it wrong, and they can do that as many times as they need to until they officially submit. Up in the top left-hand corner, you see a button that says question list. If you'll click that for us, Esther. This shows us every slide that's inside the lesson. So if a student needs to stop the lesson and come back at a later time to finish, they can. And this question list would give them a good visual to see where they left off. The circles on the right-hand side of the screen, if it's a completed filled in blue circle, that means they answered that question. If it's open, that means that they still have that question, it still needs to be submitted. They still need to select a response for that. If you'll scroll down to slide 20, I'll give you guys a little view of what a video would look like inside the lesson. So we're able to embed most of the videos that we use directly into the slide. So a student could just click this and be able to watch this video. When we talked earlier about, give us an example of a healthy or an unhealthy relationship, we gave them a carrot and said, if you find a really good one, maybe we'll feature it in this lesson. So these are a couple of examples that students had gave us. And if you'll click next, we wrap up each of our lessons with a thank you. Thank you for completing lesson 6. And then we ask them to tell us something that they learned today. So they're able to type in a response in this box again. This is really insightful for us because we're able to, we'll talk about this a little bit in a minute, but download all of these student responses. So I love being able to look back through this and see, oh, everybody liked the consent is like T video or what have you. When they are all done, they can submit their lesson at the very bottom, and it prompts them to double check their answers, and then they submit it and they are good to go. So that's just a little overview of what one of our online lessons would look like. And we can go back to the PowerPoint, Mr. As I mentioned, we're able to collect this data, the student response data, from these online lessons. So Turning Point has this fancy reports button, which you can see next to the orange arrow, and it allows us to export all of our student response data into an Excel spreadsheet. So obviously that's great for so many reasons, but especially it's great for program evaluation. And we're able to track, how many students complete the lessons, how many students engaged with it. We're able to see any common themes or trends through those open-ended responses. And we've even used their responses to modify our lessons. So for example, we had a few questions that when we made the lessons, we thought they were pretty straightforward. They were pretty clear. We had this right. And we started getting some student responses and we're like, ooh, maybe we missed something. And so we've been able to go back and revise them and do sort of an ongoing assessment with this. We're also able to monitor these responses for any red flags. So if a student maybe says that abuse or neglect is happening at home, or they're having thoughts of suicide, we're able to see that and to make referrals to school counselors as necessary. Now I will say, we have not had this happen in the online format. We had a couple of instances where we had to loop in with the counselor back when we were teaching in person. So we're prepared for that possibility to happen here as well. For the teachers who use our online lessons, we send these responses to them, and it's really a powerful tool for them. They're able to give grades based off of it, for one, but for two, they're able to use this information for those in-classroom discussions, the debriefs, and so they can really follow up on anything that needs to be clarified in class. And because the Turning Point reports are so nice and they're so easy to use, we use it for our pre and our post testing as well, and for our teacher evaluation surveys. So we ask a variety of questions on those, and we're going to go through a few examples of that. If you go to, there it is. I want to show you just some of our most recent results. So this is data from the 3 partners we worked with in the spring. There were 49 students surveyed on this pre-test, post-test, and they were 10th through 12th graders, either from a health class or from a dynamics of human relationships class. This question was, how do you agree, or how much do you agree with the following? Sexual consent is impossible when drunk or high. So you can see in the pre-test, which is the light blue, we had a pretty wide range of responses here. Most people agreed with the statement, but still 50% of our students were either neutral or disagreed. And in the post-test, which is the dark blue, you can see we moved many students to that strongly agree response, which is really powerful, I think. Our next question is, how much do you agree with the following? Drawing a personal line or boundary for intimacy is important before becoming physically affectionate with someone. We have less spread of responses here, but again, we saw movement into that strongly agree category. And so this was the pattern we see through most of our pre-testing. Students may or may not answer all the way in the desired response category on the pre-test, but movement into those desired responses for our post-test is pretty common for us. Our next question is one of our likelihood questions. So the question says, how likely are you to use effective methods of birth control 100% of the time if you choose to have sex? Results between the pre-test and the post-test here are pretty similar, but what's encouraging is that we're able to see movement into that definitely category. So we were encouraged by that as well. This is an example of one of our open-ended questions. What were 2 things you enjoyed about the class? This is something we only ask on our post-test, obviously. On our open-ended questions, we take those responses and we code them to see if we can identify any themes. So the themes that we saw in this question in the spring were learning and understanding, lessons, real life, workbook, and videos. Most students mentioned something about learning or understanding. They said, well, I enjoyed learning about toxic relationships or bad relationships and their warning signs. I learned how to make a plan before having sex, or I love learning about personality types. I liked learning how to pace myself. I learned how to prepare for my future. Overwhelmingly, that's the response that we saw was what they learned, what they understood. A good number of students mentioned that they really enjoyed the online lessons. A few said that they liked how the program was real, how it didn't sugarcoat things. They liked that the scenarios used inside the curriculum were things that could happen in real life. And we had a few students who specifically mentioned that they enjoyed the workbooks and the videos, but they really liked how they were able to express their thoughts and their opinions in both the workbook and the online lesson. Another open-ended question we ask is, what can be improved? Most students give us the generic, well, everything was great, nothing needs to be improved, it was fine, that kind of a thing. But a few students, give you good feedback. So some said that their videos were restricted on their school laptops. So that's a problem, but we were aware of that. We do work to prevent it up front by working with the teachers and their IT departments at their school. We give them a list of all the links that the students will have to open inside the lessons, and ask that they allow their firewalls to or set their firewalls to allow the students to get to those videos. But occasionally we still do have this problem. So I think about 7 students out of the 49 told us that. A few students mentioned that they wished we'd talked more specifically about setting boundaries, or that we taught boundary setting skills. So that was good feedback. Our overall, or our satisfaction-based questions are how we wrap up our post-testing. So this is the last question we ask. Overall, how satisfied were you with the Love Notes course? So our answers are, satisfied, very satisfied, extremely satisfied, but there's room for improvement here. We'd like to see many more students move into that very or extremely satisfied category, just based on the fact that all the students in the spring semester really, they completed these lessons online. Some of the responses we received on some of these other satisfaction-based questions, and just knowing that they had been dealing with online classes for a year, these students were experiencing some extreme virtual fatigue at this point in the year. So I am hopeful that if this year we're really able to get our teachers back in the classroom teaching in person and really relying more on that the hands-on activity versus using these online lessons, that we'll see some movement into those very satisfied or extremely satisfied categories this year. Now, Love Notes is a relatively new program to us, so our current program evaluation is really based on this pre and this post-test data and our teacher evaluation surveys. Once we have a few more years of data under our belt and a few more years of implementation complete, we're hopeful that we'll be able to look at things like the youth risk behavior surveys, our school nurse surveys, just some other surveys out there that school students do, and be able to see some cultural changes. But right now, we're not there yet. We haven't been implementing long enough. So in summary, we are so glad that we've overcome so many of our barriers that we've encountered to implementation. We're hopeful that we've really broke the ice, so to speak, and that, as more schools see our program growing, that they'll be more comfortable implementing Love Notes and will continue to grow. we're thankful we've been able to increase our reach and our capacity by moving away from really teaching ourselves and into embracing and partnering with teachers. You know, we started with 2 and now we're here with 20 2 years later. So that's really encouraging for us. We created these online lessons, which are proving to be so vital in our current pandemic environment. And they're giving much needed support and flexibility to our teachers. And while we are, you know, relatively new to Love Notes, we're certainly not new to working with communities. And we love that we're getting to take this program to partners all across Arkansas. And so really that's all we've got. I've sped through that, I feel like, a little bit. I'm looking down at the time now, but we appreciate you all listening to our story.
Thank you, Sarah. That was great. Thank you, Charles. I failed to mention to everyone in the audience, so of course, please ask questions. And yes, the PowerPoints from this presentation, as well as the actual webinar, will be made available. You'll be getting a letter and you'll be able to download all this information. So what I think is super important about what Charles and Sarah bring to us today are 2 points. One is there is funding in hospitals, in nonprofit hospitals, to do this kind of work, assuming that they have found needs that relate to what relationship education can bring. And so there's a document placed on this webinar on your control panel, and we have a PDF there with questions to help you think through who are the hospitals in my area? Can I look up their needs assessment? How can I get introduced to the person in charge? Because, you know, we have another client in Los Angeles that's doing this work also with they're part of a hospital, but they also do, as Charles does, they do nutritional work. They do, you know, they do lots and lots of projects. So, so for those of you who think, where's my, you know, how can I get more money? Check your local nonprofit hospital and maybe even introduce the concept that if you teach relationship skills, you can, I mean, I love the fact that you guys looked at infant mortality and you looked at pregnancy and HIV AIDS, and you could look at violence. I mean, there's so many things you could look at. So that's key, number one. Number two, these very smart people went to their family consumer science teachers, and not every state has robust family consumer science program, but most do at some level. And you could be a granting organization. There's some of you on this call that are from states. You might be a grantee and you have some money and you can work with your local teachers. So I think that's a really important thing, but let me ask some questions. What attracted most teens to your program, and how do you attract? So how are teens attracted to Love Notes? They have to sign up for one of the classes in schools, right?
They're a captive audience.
Right.
You know, our program, yeah, it's geared less towards attracting the student and more towards attracting the teacher.
Right.
When the Arkansas Department of Education revised the frameworks that the family consumer science teachers use to, you know, teach, that really created a perfect storm for us because it made Love Notes fit into their curriculum seamlessly. And then they created this dynamics of human relationships. I mean, can you think of a better class title where you're going to implement Love Notes? And that is a new class. They just, last year was the first year that anyone had used that curriculum or that framework to teach that class. And we heard from so many of those family consumer science teachers that, well, I finished my regular curriculum in early April. What do I do for the last 6 to 8 weeks of class? Well, the answer for a lot of them is Love Notes. And that's really why we got such an overwhelming response in that niche of teachers.
So on the websites of all DIBBLE programs, we have correlations. So these are what Sarah refers to, which are every class in America, every student class has, like, they have to hit certain things. And we've done it for national programs. If you want to go Google your state and family consumer science frameworks, you'll find them. If we can help you do a correlation, please let us know. Okay, next question, which I think is also super important. How do you keep teachers accountable? for implementing the curricula and completing the necessary reports. Are you incenting teachers at all, or are you just using old-fashioned, guilt?
Yeah, guilt. We don't have a carrot really, but this is something we somewhat struggle with when we start thinking about what this is going to look like when we start turning this over to the teachers to teach in person. When they're teaching in this online format, I can hold them accountable because I can see whether or not their students complete the lessons. And, and you can tell based on how teachers communicate with you. If they answer your emails when you email them and they give you feedback, or DeQueen last year, she used the online lessons, but when she got to lesson 6, she was like, let's have our students draw these healthy or unhealthy relationships. So she sent me pictures of all of their drawings. So things like that. And, if you're really reaching out to the teachers and trying to be supportive and provide them, with that interaction, you can see, when they're doing what you're asking them to do and when they're not.
So DIBBLE did a lot of work with this using classroom teachers, and we found, and we had funding for this, that we paid teachers to report. So you give them $50 when they turned in a report, and we paid $5 per student for students reporting. But I like the fact what you did, Sarah, which is with these online classes, you could tell what they were doing. How do you navigate the voluntary requirement? So lots of funds say you can't coerce kids into doing this. So how do you manage that?
We offer, we're in a conservative environment, let's be real. So we do have schools that, are concerned, that, well, a parent's going to say, I don't want my student sitting through lesson 12 where we talk about STDs and contraception. So we offer, the option that if you have that come up, you can let your student sit out for that one. They can go to the library, because we're not federally funded. We don't have a lot of issues that some of you who are receiving those federal grants,
right,
that you do. So.
Right, and the nice thing about working with health or FACS classes is often the teacher has already gotten permission. And so if a kid signed up for family dynamics, they know that's what they're getting, and the parents have probably already given permission. So, and teachers will know. That's the good part about working with teachers.
And some of the teachers do that too. They send out letters to the parents to let them know that. And then of course in Love Notes itself, it has that trusted adult connection that a lot of them will go back to their parents and show them this part of it. And so the parents are aware of it.
Right. And the other thing I was going to say is, they really, I was completely lost my train of thought. It's 4 o'clock in the afternoon and my coffee's worn off, I guess. What was I going to say?
We're talking about parental permission, student permission. Teachers were sending out letters.
Oh, it fits in with the frameworks. So like you said, Kate, the students and the parents already know, well, my kids are going to take health, and health is going to talk about STDs. So that helps, navigate some of that. And a lot of the family and consumer science teachers that we've talked to, when they are talking about relationships, they're getting into a lot of this stuff, as well. So.
Right. So here's a question. Were any teen parents part of your programming? They must be in some of the...
Not that I'm aware of.
Okay.
We don't specifically ask that, though, I will say.
Okay. Some schools do have special classes for teen parents, and some of they're integrated, but certainly. So, and yes, ACF, so King Lee is asking about ACF does support this kind of training. So most grants like you to be trained because you're more comfortable and confident, and will implement the training with fidelity. So for sure. Okay. Well, thank you again, Sarah and Charles, for coming today. I think how you showed how you do this, and FACS teachers are my favorite people nearly in the world. They get this content. They're great partners, and you can really, like you can really leverage your reach. And going to their state conference is brilliant because then you don't have to haul them out of class. Anyway, so And they almost don't need training because they've already gotten that's their field of study is family life. So, and their training. So, all righty, thank you. So thank you for joining us today. We'll be sending you a letter with an archived copy of this webinar so you could share it with your staff as well as all the handouts. There'll be a short survey. We'd like to know how you felt about it, what we can do better, what topics you'd like to see in the future. And coming next month is, really excited about this, Dr. Heidi Rueda of University of Texas San Antonio is going to talk about how she's implementing Mind Matters with a middle school population, with a highly needy middle school population. So we're super excited about having Heidi join us then. So in the meantime, thank you. Everybody stay safe. We've been saying that for a long time, but you know what it means. And so if you haven't, do it. Just saying. All right. All righty. Hate to be too prescriptive. Anyway, thank you all for coming. Thank you, Sarah. Thank you, Charles. And have a great month. Take good care. We'll see you in September. Bye-bye.